If your feet have started to feel like they don't quite belong to you anymore, if there's buzzing, burning, or a strange silence where sensation used to live while the rest of your body feels perfectly awake, please stay with me for the next few minutes. What you're going through is more common than you think, and for many people, it doesn't have to be permanent. I want to tell you about a woman I'll call Margaret. She was 71 years old. She'd spent 3 decades working as a nurse, standing on her feet 12 hours a day, pouring her energy into caring for other people. When peripheral neuropathy eventually reached her own feet, she sat across from me and said, "Doctor, this might be the cruelest irony of my entire life." She described pins and needles that would build throughout the day and turn into full numbness by midnight, a burning sensation sharp enough to jolt her awake at 2 in the morning. Feet she could somewhat feel when she woke up, but couldn't trust by the afternoon. She had already tried 3 different medications before she walked into my office. None of them had brought her feeling back. What made a real difference for her was something surprisingly simple: 7 days. 7 days of 4 seated exercises that I'm going to walk you through today. And I'd encourage you to stay through the entire session, especially for the 4th exercise, because that's the one Margaret told me changed things for her around day 3. Now, before we go any further, I want to be upfront with you. What I'm about to share today is a starting point. 4 exercises that have helped many of my patients. But neuropathy is a complex condition, and a complete approach involves understanding what's happening at the nerve level, the role of circulation, cellular health, and long-term nerve support. That's a deeper conversation than we can cover in one video. I've put together a comprehensive guide called Cellular Freedom that walks through the full 30-day protocol I've developed over the past decade for supporting peripheral nerve health. If you're interested, you can find the link in the description below. But everything I'm about to teach you right now is still valuable on its own. So let's get into it. If your feet tingle, burn, go numb, or feel disconnected from the rest of your body, drop a 7 in the comments. It helps me understand how many of you are dealing with this quietly, and it helps this video reach more people who might benefit from it. Now, before we move a single muscle, let me address the question I hear most often. Is this reversible, or do I just have to manage it for the rest of my life? Here's what the research suggests. Multiple published studies on peripheral neuropathy have shown that structured, consistent movement programs can lead to measurable improvements in nerve function. Research in peer-reviewed journals has documented that targeted exercises can improve nerve conduction velocity. That's the speed at which signals travel from your feet to your brain. Some studies have even shown improvements in nerve fiber density over time with consistent intervention. Now, results vary from person to person, and I want to be honest about that, but the key insight is this. For many people with age-related peripheral neuropathy, the nerves in your feet haven't died. They've gone quiet. They've been deprived of 2 things they desperately need: targeted mechanical stimulation and oxygen-rich blood flow. Peripheral nerves require both of those to stay active. When we sit for extended periods, when we wear thick-soled shoes that block sensory input from the ground, when we stop asking our feet and legs to make precise, deliberate movements, the nerve pathways start to dim, not destroyed, just dimmed. And in my experience working with patients over many years, what has dimmed can often be brightened again. Margaret described it beautifully. She said her feet felt like a room where someone had switched off all the lights and she couldn't find the switch. I told her the switch is still there. We just have to find it together. One important note before we begin: this routine is designed primarily for age-related peripheral neuropathy, the kind that arrives gradually and shows up as tingling, numbness, burning, or a slow loss of sensation over months and years. If you are managing diabetic neuropathy, if you've had recent foot surgery, or if you're experiencing any sudden changes in your symptoms, please consult with your own physician before starting this or any exercise program. These exercises are generally safe for most older adults, but your doctor knows your complete health picture. Please keep them in the loop. Let's prepare the feet before we ask them to work. Sit up tall in your chair with both feet flat on the floor. If you can comfortably remove your shoes and socks, please do. Bare skin against the floor gives your nerves a type of direct sensory contact they rarely get anymore. Start by slowly rolling each ankle in circles. 10 circles in one direction, then 10 in the other. You're not just loosening up a joint here, you're encouraging blood flow down into the feet and sending the very first signal to your nervous system that something intentional is about to happen. Next, gently alternate tapping each foot on the floor. Left, right, left, right. 20 taps total, soft and rhythmic. Each tap sends a gentle sensory pulse up through the sole of your foot, through the ankle, and into the lower leg. Think of it as gently knocking on a door that's been closed for a very long time. We're about to open it. Exercise 1 is what I call the seated heel dig with toe lift. If your toes feel present but slightly disconnected, if they respond to you slowly or seem just a half second behind when you try to move them, the nerve pathway running from your toe tips up to your spinal cord has grown quiet. This exercise sends a direct signal along the full length of that pathway. Sit tall with both feet flat on the floor. Now press your heels firmly into the ground. Not a passive resting position, a deliberate, active downward press. At the same time, lift all 10 toes as high as they'll go. Hold that position for 3 full seconds. Feel the tension spreading across the top of your foot. Feel the pull rising up into your shin. Now slowly lower the toes back down while keeping that heel pressed firmly into the floor. That's 1 repetition. We're doing 15. With each rep, pay attention to which toes respond fully and which ones seem to lag behind. For most people dealing with neuropathy, the smaller toes are the last to answer. Don't force them. Just notice them. Because that noticing, that deliberate attention to which part of your foot is responding, is actually how the nervous system begins to re-engage. Within the first 2 days of doing this exercise, Margaret told me she felt what she described as a flutter in her right foot. Not a full sensation, more like a flicker of one. I told her that flutter is your nerve starting to respond. A nerve coming back from dormancy doesn't return all at once. It arrives the way a radio signal returns when you drive out of a tunnel. First there's static, then maybe a word or two, and then eventually a full, clear voice. Her flutter was her nervous system starting to find its frequency again. Before we move to the second exercise, if you're finding this helpful, please hit the like button on this video. Every like helps the platform share this session with more people who are sitting right now with feet that have gone silent, not knowing there's something they can do. And stay with me, because the fourth exercise is still coming, and it's different from everything else you may have tried. Exercise 2 is the seated towel scrunch. For this one, you'll need a small hand towel or a face cloth placed flat on the floor beneath your bare foot. This exercise targets a part of the foot that most routines completely miss: the plantar nerves. These run in a dense network across the sole and arch of your foot, and they're among the most information-rich nerves in the entire human body. They're the ones that tell your brain exactly where you are in space. When these nerves go quiet, your balance deteriorates with them. Your risk of falling increases significantly, and the texture, the richness, the aliveness you used to feel through your feet gradually fades away. Place the towel under your right foot. Now, using only your toes, no help from the ankle. Scrunch the towel toward you, gathering it up beneath your arch. Hold the scrunch for 2 seconds. Then spread the towel back flat using just your toes. That's 1 repetition. We're doing 12 on each foot. Every time you scrunch, you're activating the small intrinsic muscles of the foot. Each contraction sends a signal up through the plantar nerve, through the tibial nerve, and into the spinal cord. You're not just exercising your toes. You're sending a repeated, rhythmic signal up a nerve highway that may have been dark for months or even years. Margaret told me that before day 4, the towel beneath her right foot felt blurry to her. She could sense pressure, but not texture, not the actual feel of the fabric. On day 4, she called me. She said, "I can feel it, the ridges of the towel. I haven't felt texture through this foot in over 2 years." She was emotional, not from pain, but from recognition. Her foot had recognized something again, and that recognition, the body remembering what it once knew, is where real progress begins. We're getting close to the 4th exercise now, but there's a 3rd one that lays essential groundwork for it, and I don't want you to skip it. Exercise 3 is the seated ankle alphabet. It might look simple from the outside, but in terms of what it does for the nervous system, it's one of the most thorough movements I know. Lift your right foot about 2 inches off the floor. Using your ankle alone, not your whole leg, not your hip, trace each capital letter of the alphabet in the air. Make every letter large and deliberate. Go slowly. The slower you go, the more nerve fibers you engage with each change of direction. When you reach Z, set the right foot down and repeat with the left. Every curve of a B, every sharp angle of a K, every wide loop of a G, each change in direction requires a different cluster of nerve fibers to fire in precise sequence. You're essentially running a complete diagnostic through the entire nerve network of your lower leg and ankle. Any letter that feels vague, uncertain, or hard to sense is identifying a section of nerve pathway that needs more attention. For most people, O and S feel relatively smooth, while W and Z feel effortful. The ankle doesn't quite seem to know where it is in space during those letters. Spend a little extra time on them. The nervous system responds most to the places you ask it to go that it's been avoiding. When Margaret first tried this exercise, she could trace an A and a C fairly well. But when she attempted a W, she couldn't feel where her ankle was in the air. She couldn't sense the shape she was making. By day 5, she could trace every letter and feel the path her ankle was drawing. That return of proprioception, of knowing precisely where your body is in space, is one of the most meaningful improvements I can help someone with neuropathy achieve. It's not just about comfort, it's about safety. It's the difference between catching yourself and falling. And now, the 4th exercise. I'm often asked why I always teach this one last. The reason is simple. The first 3 exercises prepare the pathways. This one puts them to use. Before I show you, I want to share what Margaret said to me. She said, "On day 3, I did this exercise, and for the first time in 3 years, my feet felt like they belonged to me again. Not completely, but mine." Exercise 4 is the seated nerve glide with ankle pump. It's fundamentally different from everything that came before, not just in what it does, but in where it works. The first 3 exercises stimulate the nerves at the foot and ankle level. This exercise reaches higher into the sciatic and perineal nerve pathways, closer to the origin point where numbness and burning begin for many people with peripheral neuropathy. This is often where the signal starts to break down before it ever reaches the foot, and this is a place that seated routines rarely, if ever, address. Sit tall with both feet flat on the floor. Extend your right leg out in front of you until it's nearly straight. Don't lock the knee. Now flex your foot back toward you, toes pointing up toward the ceiling, and hold for 3 full seconds. You should feel a gentle pull that travels from the sole of your foot up the back of your calf, and possibly into the area behind your knee. That pull is the sciatic nerve being gently mobilized. This isn't a muscle stretch. This is a movement designed to glide the nerve itself. Now point your toes away from you, foot fully extended, and hold for 2 seconds. Then bring the foot back to the floor. That's 1 repetition. We're doing 10 on each leg. Alternate slowly. Give the nerve time to settle between each rep. After you've completed 10 on each side, we add the ankle pump. Both feet flat on the floor. Raise and lower both heels 20 times at a slow, steady pace. 1 full raise about every 3 seconds. This drives fresh, oxygen-rich blood up through the calf and delivers it directly to the nerve tissue you just mobilized. Think of it as sending fuel to a circuit the moment you've switched it on. If during the nerve glide you feel a tingling sensation or a gentle current traveling up the back of your leg, don't be alarmed. That's the nerve responding. That's the signal returning along a pathway that had gone quiet. That is exactly the response we're looking for. Margaret described this to me on day 3. She said she felt a line of warmth running from her heel up behind her knee and into her lower back. She said it wasn't painful. She said it felt like being reconnected. After 3 years of her feet feeling silent and disconnected from the rest of her body, that first sensation of the circuit completing was the moment she truly began to believe improvement was possible. Now let's bring everything back down. Place both feet flat on the floor and press them firmly downward for 5 full seconds. Feel the contact, feel the pressure. Then release completely. Use your hands to gently massage the top of each foot, 10 slow strokes from the ankle down to the base of the toes. Then cup each foot in both hands and apply gentle, even pressure across the sole for 3 seconds. Finally, shake both feet loosely from the ankle for about 10 seconds. Notice whatever warmth or circulation has arrived during this session moving through tissue that may have been cold and quiet when we started. Now let me give you the 7-day framework so you know what to expect. And I want to emphasize this. Setting the right expectations matters enormously when you're working with the nervous system. Days 1 through 3, you're waking the system up. You may feel flutters, warmth, scattered tingling, or honestly, nothing at all yet. Every one of those responses is normal. The work is happening beneath the surface whether you feel it immediately or not. Nerve tissue doesn't announce itself loudly on day 1. Days 4 and 5, most people begin to notice something specific. A texture they can feel again. A warmth in the foot that wasn't there before. A toe that responds just a fraction faster than it did the week before. These may seem like small things, but they're not. They're signs of the nervous system re-engaging. Days 6 and 7, the improvements begin to carry over between sessions. Instead of fading after each workout, the gains start to hold. That's when you know the nervous system has moved beyond just responding and has started to adapt. Here are the 4 exercises in order. First, the heel dig with toe lift to wake the full nerve pathway from your toes up through your lower leg. Second, the towel scrunch to activate the plantar nerves, restore sensory detail through your sole, and begin sharpening your balance. Third, the ankle alphabet to run a thorough movement diagnostic through every direction in your lower leg and ankle, and identify the nerve pathways that need the most attention. And fourth, the nerve glide with ankle pump to reach the nerve pathway closer to its origin and support the circuit where it most commonly weakens. Do them every day. Nerve tissue responds to consistency far more than it responds to occasional effort spread across the week. 10 minutes each morning, in this same chair, for 7 days. As for Margaret, she completed day 7 and called me on the morning of day 8. She told me she had walked to her mailbox and back without looking down at her feet once. For 3 years, she had watched every single step, afraid of what her feet might miss. On day 8, she simply forgot to watch. Her feet knew what to do. She still manages her neuropathy. She expects she always will. But she said something to me that I've thought about many times since. She said, "It's no longer something that's happening to me. It's something I'm in charge of." That shift, from feeling helpless to feeling in control, is what 7 days gave her. Not a cure, a sense of agency. Your numb, burning, tingling feet are not necessarily something you just have to accept. 7 days, 4 exercises, a chair. Give it a try, and when you feel something shift, come back to the comments and tell me which day it happened. Tell me what changed. I read every single one. Hit the like button so that someone else lying awake tonight with burning feet can find this video. Subscribe so you don't miss what's coming next, and share this with someone whose feet deserve better. I'll see you in the next one. Disclaimer: this video is for educational and informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with a qualified healthcare provider before beginning any new exercise program, especially if you have diabetes, recent injuries, or other underlying health conditions. Individual results may vary.